I was an English major as an undergrad, and after that I joined the Peace Corps and moved to Central Africa. One day I got a paper from a student, but the language on the paper didn't line up with what he'd been taught. And I thought, I wonder what's going on there. And the word I know now is dyslexia. And at the time, I thought, I want to dig into that. I want to know what's going on. I want to help students on an individual level in a way that is harder as a classroom teacher.
When I was in high school, I volunteered at a camp for kids with speech and hearing disabilities and fell in love from a really early age. Like, there's the kids that are like, I'm going to be a dolphin trainer. And I was like, I'm going to be a speech language pathologist. And that was it.
We're proud of so many things about the speech pathology program at Rutgers, but one that is really meaningful to us is our diversity. Our faculty come from all around the world, speak different languages, and study different areas of speech pathology. Our clinical educators have worked in hospitals, private practices, rehab facilities, and they bring that experience to us.
We truly live our values. Interprofessional practice, healthcare, diversity, those pieces are so woven into everything that we do and believe in, something that we embody and not just something that we put on a website to entice people to come. It's a hands-on clinical education that begins right away. Going into the clinic and applying what you are learning about with real clients that have real needs. Our approach is to start them out right away, but with a very, very high level of support. You're paired one-on-one with an expert clinical educator that's there to really shepherd you through the process. It's a combination of kind of pushing you out of your comfort zone, but giving you a lot of support and hands-on collaboration to make sure that you know that you're not alone in the process.
The Rutgers Speech Pathology program is interprofessional work with students from other disciplines. We have students from the translation and interpretation program who work in our clinic, translating for families and for our students. We also have a social work intern who helps our students know what resources there are for their families in need. We also work with PT and OT, so we're very interprofessional.
We have strong partnerships with all of the major hospital systems in our area. Robert Wood Johnson is one of our primary partners. We're in schools, we're in private practices, we're in early intervention centers. We're really everywhere that SLPs are, we are also in the community.
One of the really neat things that the Rutgers Speech Pathology program offers is the deeply personal connection that we make with our students and that our students make with our clients.
Our clients are our neighbors. We work in a community that feels like family. We are here because we belong and because people deserve good care in our community, and we're really proud to give it to them.
For people who are deciding between graduate programs, begin with the end in mind. What kind of speech-language pathologist do you want to be? Do you want to be prepared to see anybody from anywhere with any disorder? And if you do, this would be a wonderful opportunity.